So, how is this COVID thing affecting you if you are pregnant? As we can, okay, some of the initial studies have actually shown that between the non-pregnant and the pregnant women, the number of, the percentages seem to be similar, which is 80% of people can be fairly asymptomatic, which means that you do have to be careful when you go out there, because I think most of us may not be carrying very much symptoms at all, but we could be spreading the virus itself. 15% may get a bit more serious, requiring oxygen, and about 5% may require ICU care. And you can see that in the pregnant women, the percentages seem to be rather similar. So although we always think that in pregnancy, it's an immunocompromised state, right? It doesn't seem like the disease can be a lot worse if you were to get it in pregnancy. But of course, the worry is that you do have a baby inside you, so it's two lives, involved. So I think for a lot of women, especially if you're in your last trimester, you would want to be a bit more careful with regards to going out there. Be a bit more prudent just in case, because you find that in the pregnant group, the women that tend to fall in to have it more serious or requiring ICU tend to be the older moms, those who are overweight, diabetic, hypertensive, quite similar to those in the non-pregnant group, and those in the last trimester. Okay. Based on what we know about COVID at this point, as with all viruses, there can be a small risk of causing congenital infection, and there may be a chance of spread through the placenta, causing growth restriction, early labor, and all that. But overall, the likelihood actually is still fairly low. So in most cases, I think the dangerous part is if the disease is serious in the last trimester, then it might trigger off an early labor, or sometimes the need to actually deliver because you're in a serious, you're having serious form of the disease, and it'll be easier to manage to deliver the baby. So sometimes the early delivery is more because of management purposes for your case, you see. For congenital infection, right, so far, I think there hasn't been anything that's detected yet, as in it causes structural abnormalities and all, which is quite similar to most viral infections. Usually, it is rare for us to see it actually affecting the fetus. So on the whole, I think we are going to have to get used to the fact that COVID-19 is going to be here to stay, and we probably would have to treat it like a viral infection with the usual precautions, more precautions, of course, because you know how infective it can be. Just a last note on COVID in pregnancy, whether if, let's say, a lady who has COVID is in labor, would there be any difference or not? Okay, again, like I said, because it's something that, thankfully in Singapore, we haven't had many cases of pregnant, laboring ladies with COVID, but I mean, I hope the opening up and all that will not increase the numbers. Should we do a caesarean section versus vaginal delivery? I think if the mom has a serious condition of COVID, she can't breathe, she needs oxygen, definitely a C-section, because you can't even push, right? But I think in cases where they are mild, I think most people will still go for a vaginal delivery. Breast milk is still a yes. Please do give the baby a breast milk, because the virus hasn't been detected in the breast milk, okay? When it comes to breastfeeding, although the WHO recommendation is yes, breastfeeding, skin to skin, but you know that COVID is transmitted through respiratory secretion, so there would be an increased risk if you're doing direct breastfeeding. If you still want to do that, and then of course, wearing a mask and making sure that you don't touch the mask and all that, because I think a lot of times when we wear masks, we are actually not very conscious about touching things and touching the mask, and then you are actually transmitting already. So you have to be very particular, okay? So I think in most units, most hospitals, we do suggest that if the mother is not opposed to it, the baby should be nursed separately from the mother so that there's less chance of the baby catching COVID. Now, if you are with your baby, skin to skin, the likelihood of your baby getting COVID will be very high. And then you need to think about the other caregivers who are at home, who are going to be looking after your baby, who's very likely going to be COVID positive too if you are directly looking after your baby, but maybe asymptomatic and very likely asymptomatic, right? Okay, so these are just some thoughts. I think nobody really knows the answer yet.